Hello guys, hello everyone. Hello. Can you hear me guys? Can you hear me? So let me see if you can hear me. I have to check as well guys. Let me check. Make sure you can hear me. Mm. Hello? Hello guys. Hello. Hello? Can you hear me? Hello? Okay, this is perfect guys. How are you? For some of you who don't know me, my name is Nurse Rena Cadou, guys. So, how's everything, guys? Hopefully, you are doing fine, guys, by the grace of God. Okay, so I'm going to talk a little bit about a few changes, guys. Okay, about Nclex will be started on April 1st, 2026. Okay, so I've heard a lot, like, student, like, they are very, very, like, afraid of. But I'm going to clarify everything for you guys. So, moi, pral juste clarifier, ok, moi, juste clarifier, et pour new test plan, ok, new test plan 2026 là, cap commencé effective en 1er avril 2026 et gen quelques changements qui fait qui pas trop gros mais gen quelques changements qui fait. So according et tous like ça que moi joindre dans website board yo m'tale et puis moi même capable share avec nous. OK? According to a few board nursing website I've been visit, so I'm going to update you right now, guys. Okay, please, if you join this live, share the live with your friends. At least your friend can know as well, guys. Okay, I know some people ask you to pay. Okay, some people ask you to pay, but I'm not asking you to pay me anything, guys. So get ready. Okay, so get ready for that. Okay. Give me 1 second. Give me 1 second, guys. And also, I know you have been trying a few reviews, so which is you haven't a success, guys. So this is the best time you can join. My next review will be started on April 15 and to August 15 will be the last day. So you can register online at Care for All and Cadou.com. Yes, you can register on my website at careforallcadu.com. So give me 1 second, guys. I'm trying to update something. So I want to make sure, um, okay. Hopefully you can hear me properly, guys. Okay. Hopefully you can hear me properly. I think so. Okay. So, guys, like I said, guys, I'm going to update you. So give me 1 second. Okay. So Nclex RN LPN 2026 update will be effective April 1st, 2026. So no pressure, okay? So pas prendre pression. Stay calm, guys, because you are the one who gonna write your exam. So no one else will be writing your exam for you. So don't be pressure. Don't be listening whatever people say about what gonna be and class gonna be changed, right? So you know you study your stuff, and guys, if you really need help, I can help you out. Okay. So I think this week I have three. I seen three people, so three of them were success, guys. They pass the exam. Um, if you don't really know how to, like, study where we're supposed to start, then I can help you out. Please share, please share, please share. Don't forget to subscribe if you join my YouTube channel. Okay, so don't forget, guys, to subscribe, and you can get any update um for next time. Okay, so pas oublier abonner avec YouTube channel moi, et puis prochaine fois pour capable si y a bien n'importe live n'importe bail qui est important on connaît. OK, so like I said, guys, si tu as besoin prendre review ou prendre plusieurs reviews ou pas jamais qu'à passer, OK, ou pas jamais qu'à passer, then moi gon review qui a commencé le 15 avril pour arriver 15 août. Ou ka aller dans website moi qui c'est careforallcadou.com. OK, careforallcadou.com. careforallcadou.com. So moi toujours employé tout stratégie moi pour capable comprendre pour quelque soit si moun m'a étudié avant pour moi capable faire comprendre ça que m'a expliqué là. OK, so m'gen stratégie pour ça, même si son moun ou son visual learner ou son moun qui apprend avec un pile écriture, OK, un pile notes, so m'pa gen et problème avec ça, so moi capable aider ou. OK, so ou capable aller enregistrer en ligne. So however, moi capable quitter numéro de téléphone moi c'est 941 290 0745. So my phone number is 941-288-0745. Please, guys, if I have someone under this live, you don't speak Creole, just let me know because I'm Haitian. So I will do the live in English and Creole. Okay, Creole for my Haitian people. But if I say something and then in Creole, uh, would you like to know whatever I say in Creole so you can just say can if I can translate for you? Okay. Um, Hold on, guys. Give me 1 second. Okay. So parce que si c'est ou même qui étudie à faut pas quitter you know what mon a fait tout chaud. Okay, I think right now I need to do something else, guys. Give me one quick second. And hold on, guys, hold on. So, what you need to know, student, about this new update, which is will be effective on April 1st, 2026, right? I've seen before I start, I've seen a few students they are really afraid. They say, you know what, because there will be a lot of changes, so that's why I just wanna book for my exam before April 1st. Guys, don't do that. Don't do that. You remember since 3 years ago when the board nursing like were changed the test. Did you remember? I think 3 years ago, the broad. So what the broad? I remember the broad, like energy, energy, yeah, energy style. Okay. So energy, which is very, 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 very easy than ABCD questions, guys. I don't know sometimes why students don't like energy. So energy is the best. Energy is the best. Is the best. Is the best, guys. Okay. So number one, structure of the exam has not changed. So the structure of the exam has not changed. So structure examen li pas changé, guys. Okay. Ok, structure examen li pa chanje. So, we still have the same four major categories. Ok, so nou still genyen 4 gran kategori nan examen. Same percentage weight, right? We still have the same percentage weight. Okay, please guys, share the live, so don't be selfish guys. Okay, don't be selfish. Please share the live. This is very important. Share it guys. Share the live. Share the live guys. Share the live. Share the live guys. Share the live. Share the live. Okay, same passing standard. Okay, même standard yo, même standard yo pour passer. Next generation Nclex, which is NGN, case study still use. Okay, avait dit wap still join. Okay, NGN Nclex next generation wap still join a case study, c'est l'école data apply, so y a toujours dans examen on là. Okay, y a toujours dans examen on là guys. Ok, so m'a continuer guys, m'a continuer ensemble avec nous. What about clinical judgment? What about clinical judgment? Okay, what about clinical judgment guys? Clinical judgment is still the core guys. Okay, so the clinical judgment model reminds the foundation guys. Number one for your clinical judgment. Number one, recognize clues, which is very important. If you have a case study, like if it even a single question, so you need to recognize the clues on it, because if you're not unable to recognize the clues, then you will not get the questions right, or the case study you will miss a lot of stuff in your case study guys. Okay, then what else? Analyze data. Okay, all the time you need to analyze data. Faut capable analyser ça que yo ba ou an, ça que qui devant nan, OK? Ça en dans question là, ça dans question. Si pas capable analyser, then ou pas capable joindre yon réponse pour lui. OK? Number 3. OK? Prioritize. OK? We still have prioritize, guys. Okay, and if you don't know that, your exam is 75%, 75% of prioritization. You need to put that in your mind. Put it in your mind, guys. Okay, so your exam is 75% of prioritization. Okay, exam on a 75% c'est priorité yo ye. Okay, 75%. And again, general solution. Okay, usually guys, when you have a case study, you collect data, you analyze data, you prioritize. So like I always said, even in my review with my student, do not look at for chronic whatever chronic situation your clients have. Clients been living with hypertension, diabetes, so whatever diseases. Okay, so right now you need to look at what burned my client in the emergency today. Okay, the chief complaint of your patient. And number 5, take action. Okay, so when something happen, so when your patients come to the emergency, so right now according to your patient's complaint, right, then you're gonna say, okay, this is my action I'm gonna take, which is part of nursing intervention. Okay, action, nursing intervention. So qui ça va faire? Ok, pendant que client lui-même li vini ou fin faire analyser tout bagage, ou fin prend tout ça que client fin dit, qu'on a on pral prendre action, ou pral faire intervention pour client pour qu'à sauver la vie client. OK? And after that, when you're done, you need to evaluate. OK? So, l'on fini, faut capable faire évaluation. OK? Evaluation, very important. So, let's say you are dealing with a MI client. Okay? So, what did you do? Okay? What did you do for your client? What was your nursing intervention? And after that, you need to evaluate your patient. So, which is this is part of your nursing process. And you need to put that in your mind. So when you are going to write your exam for Nclex, guys, some questions, in order to answer them, you need to use nursing process. So which is include um assess your patients. Number one, always assess, always assess, always assess. A lot of students get like answers wrong because they don't assess their patient. If you don't assess and then you just jump, you just go for like implementation or evaluation or intervention, or just like go for the diagnosis. No, you need to assess your patient first. So this is number one all the time, guys, right? And number two, after your assessment, yes, you can diagnose and your plan. So what you're gonna do for this patient, and after your plan, and now you can do your intervention or implementation, and the last one will be evaluation. I'm telling you that most of students who do not success, who do not pass NCLEX exam, because they don't know what theory, what technique they should apply. So if you don't know type of theory you should apply, then you will not get it, guys. Okay, you probably know all your contents, you know them very well, you are very smart, but if you don't know the technique, then you will not make it. Okay, for example, you have a ABC question is in front of you. Let's say your patient have like um airway issue or breathing issue, or can be circulation issue. You cannot even recognize that if you're supposed to apply this technique ABC, airway, breathing, circulation. Okay? So, sou pa konen teori sa yo, la difficile pour même si tu smart, mais si tu vraiment intelligent, so la vraiment difficile pour guys pour passer examen NCLEX. OK? La vraiment difficile. Seconde question qui devant, c'est ABC pour utiliser, qui c'est airway, breathing, circulation, but you decide to drop yourself all over the place instead of using the ABC to get your answer, then you miss everything. Because if you continue doing your exam like that when you are sitting in front of the computer, so you're gonna miss a lot, then you're not gonna pass your exam. Okay? And let's say you are writing your exam and then you find a question, but you don't know anything about these questions. You don't know how you're gonna answer, especially if it's A, B, C, D. Okay, so you don't really know. You say, "Oh my God, I haven't seen this when I was like doing my study stuff like that. When I was in school, I haven't seen that thing in front of me. So what I'm supposed to do? So just pick the answer. You see your patients is safe. Pick the answers gonna keep your patient safe. Okay, so I'm giving you this trick, guys. So what about case study? Started April 1st, 2026. So case study will continue. So some students were expected they will not see like a case study. So case study will be still a like showing, guys. Okay. So case study will continue to test real world nursing decision. Okay. I love case studies. I love select all data. I don't know why students don't like case studies or select all data apply. They are so easy. Okay, So case study is so easy. So you have a case study before I end this live. So I will do maybe one case study with you guys. So case study is so easy. I will give you some trick how you can do your case study in future. So I don't know why students don't like case study. Okay? Mais pour qui ça ti moun yo student nous même nous pas aimer case study qui vraiment facile, c'est l'école data apply vraiment facile. So dans yon case study du moins si on c'est l'école data apply côté que ou pas perdre tout point dans l'examen. Hein? Ok, si par exemple sur 5, ou fait 3, ou vient 3 sur 5. However, si case study, I mean, select all that apply ou ba ou ali sous 5 points, si ou jwen 3 qui bon konnen yo, ça ou te fait yo, ou konnen yo, please do not change. Do not change the answers. Do not pick up extra answers you not even have no clue about it. So don't do that, guys. Okay? So le na fait c'est l'école data apply yo. Ça côté vraiment qu'on est ou sûr ou fin prend réponse ça ou quitter réponse ça yo. Sont pas sûr plutôt pas prendre du tout. Parce que vous doit faire 3 sur 5 et puis vous avez deux autres bagages ou pas sûr de yo qu'on a ou décidé prendre yo qu'on a vinn descendre pour qu'on vinn faire 1 sur 5. Uh-huh. Do you get it? So c'est comme ça yo marqué yo pour guys, okay? So qui est-ce qui dans chat là? Qui est-ce qui là guys? Give me 1 second. I'm checking something. Okay, so guys, ou prend examen plusieurs fois, ou pas jamais ka passer gon bagay qui pas bon non ou qui pas travail nan ou. If you haven't taken your Nclex several times, you haven't succeeded, that means you have a issue. The issue is in you. So you need to fix it. Like I said in the beginning of my life, probably like smart student, probably you were the first one in your classroom, the first smart student. But if you don't really apply your critical thinking, yeah, if you cannot apply your critical thinking, you don't really know whatever case study, let's say you have a disease in front of you, you don't really know the pathophysiology, complications, right? Causes, risk factors, then you will not able to get it, guys. And what technique you should apply for ABCD's questions? If it's ABC or Maslow theory, if it's like safety, right? So you need to know them. Or you need to apply your nursing process, which is, guys, me and you, we were learning those stuff when we were like just started, maybe I think on the first semester nursing school. So how come you don't remember your nursing process? How come you don't remember them, guys? How come you don't remember them? Okay, so let's continue. Let's continue, guys. Let's continue. And hi, guys. So if I have someone under my live, you don't speak Creole, let me know. So that's why I'm doing the live, sometime in Creole, sometime in English, because I'm Haitian, guys. So I have to do it in Creole and then English, guys. So give me 1 second again. Okay. So right now, so what about terminology? This is very important. Oh my God. Terminology very important in your update. April 2026, April 1st, guys. Some wording was modernized, okay, to reflect current practice. Ok, so gan pil terminoloji ki chanje nan examen Nclex wa kap gen pou chanje 1er avril 2026. So se sa k fèm toujou di lè yon moun ap fè review avèm. So gen terminoloji lò ou pa konen yo, wal chèche konen yo. Ok, wal chèche konen yo. So li plus facile pour Nclex do kapab do like shortness on exertion instead of yo that do like dyspnea série de bagay qu'on peut capable faire facile pour. OK? Gan pile terminologie qui change dans examen Nclex 1 qui a commencé 1er avril. OK? What about OK, bon ba ou some examples le moins de terminologie qui a bien pour changer dans examen guys. Safety and infection control. Okay? So safety and infection prevention and control. For example, instead of nous qu'on dit safety and infection control, so Nclex change ça. Okay? Instead of we used to use that one like safety and infection control, but 2026 April 1st we will say safety and infection prevention and control. This is change. No more safety and infection control. So now they add prevention on it. Okay? Prevention on it. What about substance abuse? So this will be changed April 1st, 2026. Instead of substance abuse, a lot like clients sometimes they use like substance abuse. So we will not say that anymore. So we'll say substance misuse. Substance misuse, okay? So, mwen ba ou exemple ki sa par exemple ki ap chanje nan test plan 2026 lan. Par exemple, sou te kon di safety and infection control, koun ya 2026 kap komanse a parti 1er avril, sa ke wap di safety and infection control and prevention and control, okay, which is IPAC, okay, IPAC, okay, okay. So, ça c'est par exemple yon ti clarification mwen ba ou sou sa. Okay? Okay, so what about now? Ki sa pou plus vraiment like ne kapab do focus guys. And avoid biases scare. Avoid biases scare guys. Avoid biases scare. Okay? For example, new language emphasizes. New language emphasizes. Providing unbiases, not biases, providing unbiases, respectful care, supporting dignity and privacy of your client, culture competence in communication. For example, exam scenario may test ethical and inclusive care more clearly. Okay? Respect your client culture, guys. So what else about this new update, guys? So, pas oublier pendant m'a fait live là, sous son petit monde, ou toujours gen problème, tout ça étudier yo aller, ou prend plusieurs reviews, OK? Moi-même là pour m'aider. OK? C'est ça que fait moi gen yon bachelor en éducation pour moi capable aider ou moi gen technique pour. Moi gen technique pour. And beside that, moi gen un livre ça, OK? This is my new book. Son livre toute maladie ou fait yo capable maladie ou paraître devant. OK, moi tout mette image là pour vous. OK? Moi tout mette image pour vous de maladie que ou gagné pour et faire review pour Nclex. So this book will be available very soon, I can say, on Amazon. Maybe a few more weeks. I need a few more weeks, okay? But right now, if you need a copy, which is ebook, then you can contact me or you can go online, you purchase, and then I will send it to you via email. And this is so cheap. Okay, this is so cheap. So this book can catch your attention while you are studying, guys. Even you have decreased memory. Okay, so this will help you. This book, it's straightforward. Okay, straightforward, guys. Okay, So my phone number 941288075 if you need a copy of this book, which is very, 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 guys, clearly the explanation. I put everything on it for you. All the diseases you need to know for your Nclex exam. I put all the medications you need to know for your Nclex at the end of the book. Okay, and labs. Even they're gonna give you lab, but at least for your future, guys, you need to know them as well. Okay, everything's there for you. And nursing fundamental, so if you buy the book you will see them. I put them in the front of my book. Okay, okay, guys, so right now, okay, what about other expectation? So there will be, like, internal monitoring devices. Okay, for example, ICP monitoring, intracranial pressure monitoring, and arterial lines still in your exam. Arterial lines, okay, and IUPC, which is intrauterine pressure catheters. This will be in your NCLEX started April 1st, 2026. Okay. And which is ça yo vraiment pral tester et student là dedans yo. OK? But jan que NCLEX pral faire, yo pral plus accentuer et sous genre de bagay sa yo. IUPC, which is intrauterine pressure catheter, arterial lines, and ICP monitors. Okay? So NCLEX pral vraiment accentuer sous sa yo. So content still reflect safe entry level practice. So content yo toujours été vraiment sécuritaire, ok? Pour capable rentrer dans level practice so as a nurse, guys, ok? But NCLEX will still continue to prioritize your exam, okay? NCLEX will still, guys, continue to prioritize your exam, which is I mentioned in the beginning of this live. So your exam is based on almost 75% when it's come to prioritize, guys. Safety, prioritization, delegation, evidence-based clinical judgment, okay? So this update does not change, but you as student, how you should study, guys. How you should study. You're gonna study the same, but the only thing, when you study, you need to go deeply, 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 very deep, guys. Okay? So, qui ça qui pas changé? Cap gen pour pas changer à partir 1er avril 2026. Qui ça qui pas changer, ok? So, what didn't change? Qui ça qui pas changer et qui pas changer, guys? No new categories. No new categories. Okay? What didn't change? Tande sa m'a dit ya. What didn't change, guys? Qui ça qui pas changé? No new categories. No new passing score. No elimination of case studies. No radical redesign. Okay, let me repeat one more time. No new categories. No new passing score. No elimination of case studies. I love case studies, so they are so easy. No radical redesign, okay, in your exam, guys. So if you need a copy of the 2026 test plan, which will be effective on April 1st, it's free. You can just go on Google, you go whatever browser you are using, you can just go online, you can get a free copy, or if you are my student, I can just share a copy with you. So don't listen to people say you have to pay for that. Some people they are greedy guys. No, you don't have to pay for that. Why you gonna pay for that, guys? Why you gonna pay for that? Okay? So now, like I said, let me do a nice case study with you before I end my life, because I'm going to um do review with my student online, guys. Okay? I have Zoom review, so I have to go. But let me do one case study with you guys. Case study is so easy. I don't know why students keep like oh, case study is too difficult. That's not true. That's not true. I love case study. Um, Let me do this case study with you. Okay, so this case study will be on maternal and newborn. Okay, this is a nice case study, guys. Very nice case study. This is very nice. So I need to open. How to open this first? Doesn't want me to open this. Okay. Okay, guys. Okay, here's the case study. Are you ready for the case study before I end my life? Because I have to go online to teach, guys. And if you are looking for someone who can really help you out, who can really make you understand, okay, everything you need to know for your Nclex, contact me at 941-288-0745, guys. Right? 941-288-0745. Right? Um, Give me 1 second, guys. So I'm looking for. Oh, I have to stay here. Okay. First of all, give me 1 second, guys. Uh, 1 second. 1 second, guys. 1 second, guys. 1 second, guys. 1 second, guys. Okay. Like I promised, guys. So now let me do the case study before I end my live with you. Hello people on YouTube and hello people on TikTok. So right now I'm live on TikTok and then I'm live on YouTube, guys. Hopefully you can hear me properly. Okay? Hopefully you can hear me properly, guys. Hopefully you can hear me properly. Okay, so I have to test it on my TikTok, guys. Make sure people can hear me properly, right? Before I start my case study. But right after my case study, I will end my live because I'm going to teach online. My student waiting for me, guys. Um, hello. Can you hear me, TikTok? Yes, TikTok can hear me. Okay. So is a nice case study. Let me read it, guys. Let me give you some trick when you are doing your case study. If they provide you health history of your client, assessment, check your assessment, check health history notes, and check vital sign. Anything Nclex provide you, read them, guys. Read them, guys. Please, read them. Okay, read them. If you miss sometimes, like even you miss like to read your vital sign, this is probably where the answer you're supposed to answer in your question. This is where Nclex write it. So I always read everything: health history, assessment, labs. I mean, new diagnostics. So I always read them, guys. Okay, so let's go. A 32, a 30 years old client who is 30 weeks pregnant and a G4P2 arrived to labor and delivery for evaluation after experiencing moderate vaginal bleeding. She denies cramping and pain with bleeding. Client has a history of a previous C-section. The client has left hip pain that shoots down her legs and a 2/10. This is the pain scales. Okay, headache with no visual disturbance. So no visual disturbance. The client reports feeling frequent fetal movement in the last hour. Okay, so you already know your client history since your client was admitted, guys. Okay, the first day admission. You're not gonna check the history, but at least you're gonna do like assessment. You're gonna collect vital sign, which is very important, guys. Right? So then, right now, don't remember that, guys. Que m'a quitté nous by mbral dans Zoom review avec student. Ok, pour le me déplacer pour nous dire oh Miss la vraiment m'a levé mais là quittez nous. Ok, so right now I'm reading the assessment. Neurologic, alert and oriented time 3. Deep tendon reflexes 2 plus. What about respiratory system? Clear breath sounds, symmetrical, unelaborate. What about cardiovascular? S1, S2, present. What about GI, gastrointestinal, guys? Bowel sound, normal active, time 4, abdomen soft and non-tender. Extremities, 1 plus pitting edema bilaterally in the lower extremities. What about the projective system? Fundal measurement is 30 centimeters, voiding without difficulty. Moderate amount of bright red blood was noted on the peripad. Uterus relaxed, normal tone. Moderate amount of bright red blood was noted on the peripad. Okay, uterus relaxed, normal. Okay, tone. Okay, what about the vital sign? Souman ke kite yon nan bagay sa yo, sa kapap fò pa jwen réponse le a pose question nan par exemple nan question ou la. You need to read everything. Read tout bagay net, pa kite an yon ate. Check it, click en lè, en bas. Sometimes Nclex put them on the top. Sometimes, they put them, below of your exam. So click everything. Okay. So what about the vital sign? Temperature 98.2 Fahrenheit and 36.7 degree Celsius. Pulse 80, respiration rate 18, blood pressure 102/81, right? Pulse oximetry reading 98 on room here. That's good. So for the, I can see the vitals, okay. Yeah, okay. Slightly, the systolic is 102, which is normal value for a systolic is 120, but it depends on the client condition, guys, okay. So here's the first question, and Nclex asks you. Which of the following findings required immediate follow-up? Select all that apply. I love select all that apply. I love case study. They are so easy, 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 easy. Okay, when you sick, when you go to see, for example, your family doctor, what is the first question they ask you? Hi, how are you? Why are you coming here? Oh, dog, I'm not feeling well because a couple of days ago I'm having really heavy abdominal pain, stuff like that. And sometimes if they ask you, okay, can you touch the location? You can say, okay, it's here, okay, right lower quadrant, probably appendicitis, but the doctors doesn't know yet, right? So this is your chief complaint, and you're gonna find sometime a LPN or RN start like with your vitals, and will see you. This is the same thing in your case study. Okay, this is the same thing, guys, in your case study. Okay, this is the same thing, the same thing, same thing. I don't know what I'm keep coding. Let me check, guys, give me 1 second. And si vous prenez examen plusieurs fois, par exemple, passé, eh bien, moi, je font camper là, font camper. Suspend prend quoi boire, voyer, jeter. Camper là, parce que gen moun ka bo review, moun nan li pa care parce que moun nan juste l'argent li besoin fait. Moun nan pa care que ou pas passé, moun nan kon pral fon session, ka prend 4 mois, 6 mois, 3 mois, moun nan get ap contrôler que m'a gen 20, 30, 50 or 100, 200 students. So gen moun c'est l'argent yo, but moi réussi non d'abord. Et ça fait ouais m'te voye 3 students aller semaine passée, tout OK. Moi dis bon Dieu merci. Ou ap gade m'te gen yon RN parmi yo qui c'était Angela. Moi te connais le t'a passé. Depuis on a passé moi connais mais faut attendre. Même là où commence à faire practice, ou commence à base up now you all, I can say you all is one of the best, like website ou capable d'utiliser après ça bootcamp. Et d'après un peu de recherche, moi fait deux ça c'est numéro 1. You all and bootcamp. You all and bootcamp. Utilisez-yo. Même là que vous commencez, vous faites 30%, 40%, 50%, 60%, rete. Refaire yo. You need a notebook. Like I always said, guys, look, I'm not a student, but I'm still taking notes when I'm doing, my review with my student. So you need a notebook. And I don't know what kind of book you are using, but me, I have my med search book, which is I really love my baby. Where are you, baby? I love my baby girl. This is my med search book, guys. If you prefer Sanders, you just say you skip it. But me, this is my favorite one. Raison qui fait me dire moi-même pas remettre Sanders, c'est parce que sans que moi learn, j'en cerveau me fonctionner, il pas capable de capter ça qui dans Sanders. Par exemple, je dois appeler un si j'en capable d'apprendre, two guys. Ou gen doit visualiser bouche top marché, prend bagay en bas bouche mon paquet bay mon ap di, mon pas même ça l'a di, pas même ka explain yon bon pathophysiologie même. Et puis moun sa paye n'importe $1000 chaque mois pour yon petit review la favor. Il est vrai nous spend time, bay ça yon petit bay qui petit lié. On va mettre toujours nous utiliser, toujours nous gon livre nan, depuis je mon laptop devant. Toujours faire recherche qui ça ka bon pour nous, right? So pour update examen et mon TikTok yo moi allant live là les la finale dans commencement live là dans YouTube ou capable update qui gagne dans examen là. OK? Et sous besoin yon copy of 2026 test plan, so this is free. Ou capable prendre online pour contour de bout taper mettre board nursing, new update test plan en PDF copy. Soit m'voyer le barreau. Pas occuper mon cap jou ba $20, $30 pour lui, $50. No, it's free. M'ka voyer le barreau. Ok, so, qui question yo pose là? Which of the following findings require immediate follow-up? Select all that apply. Yes. Tout ça, moi, connais que m'bral agit dans l'immédiat pour client qui moi client passif là, OK? M'bral agit pour moi kavin mettre c'est m'kavin mettre et patient nan comfortable. OK? Par exemple, ou aller dans emergency. OK? Ou aller dans yon emergency bamba non story on le en l'hôpital général, moi te yon ti dame qui valon kenep la chita lal. Dans gorge là, li presque tout fait, l'angle a saute dehors, yeux le sorti, docteur poko jamais ka vinn sou li. Et puis m'gon lame l'eau saute dans yeux. OK? On lame l'eau saute dans yeux, me dit regardez comment on a mouri avant green kenep qui là, ouais boule kenep là rete là. OK? So, dans moment ça par exemple, client ça li pas de kaken bécole parce que airway li presque obstrué, presque bouché. Mais c'est ça. Do that thing to me. So I have good internet, so de temps en temps, ils font camper. OK? So c'est ça m'bral fait là. OK, yo ban moi number one headache, fondo measurement. On ti moun ta bon fondo measurement, c'est pour ta kalo. Pour ta bon fendo measurement. So qui problème qui gen là? Est-ce que fendo measurement là sou pas fait client mourir? Non. C'est sur hauteur. Vous comprenez? Parce que le nous enceinte, le bot ko enceinte ou te gen fond utérus qui te sous table bobot, OK? Kounya la li monter, tout temps si moun a grossi la monter fond utérus là. Et ça fait leur fin accoucher, faut le tourner venir la caille encore côté le té. Faut faire massage pour le descendre. Lower extremity and fighting. Moderate bright red vaginal bleeding. And left hip pain that shoot down the leg. Okay? I know some students, some of you guys will say because the question asks you about select all that apply. What put tout ça, you're gonna take everything. Can be 1 and 3, 4, 5 is depend on the client's whatever condition. Okay? Okay, so I have to do something, guys. Give me 1 second. I don't know what I'm keep like, whatever. Because when connected to YouTube blanc to get why ça fait ça. Même sur toi, même sur Facebook, only YouTube and then TikTok. Okay? I'm leaving soon, guys, after this case study. Ma brale bientôt. I'm quitter nous bientôt après case study. Okay? Mais comment yo marqué point ou pour le ba ou select all that apply ou du moins select all that apply. Si ou te supposé jeune et il te sous 5 points. Ou supposé faire 5 sur 5. Ou jeune 3 sur 5. 3 ou sur, tout ça ou sur yo, pick up yo, pas quitter yo. Tout ça pas sur, pas pick up yo. OK? Ou end up avec 3 over 5. Mais si gon baga ou pas sûr, my friends, my sisters, brothers, listen to me. If you are not sure about any answers, please do not pick up that answers. Will reduce your score. Okay? You know 3 or 2 are correct. Leave them alone. You are not sure about this, C or D. Do not pick up. Do not. Okay? Let's say you already know 3 good answers for select all that apply. Okay? But you probably say, oh, I don't know the rest. You get 3 over 5. Let's say you decide to pick up 1 more answers, not even belong, like, to the answer you're supposed to pick up. Réponse surprend, li pas même match avec ça qu'on prend. Qui ça a fait, ou te gen 3 sur 5, qu'on a vin descendre 2 sur 5. Ou bon l'autre answer encore qui pas bon, 1 sur 5. Ou bon l'autre answer encore qui pas bon, 0 sur 5. C'est comme ça qu'on marqué c'est l'école that apply one. Sou pas sûr, pas prendre answer, quitter l'enrepoule. So skip avec ça gain. Comme ça, ou fait belle note. Ou pas sûr de bagarre là pas prendre tintin. Ou pas jam te kon l'école ou pas de songer li, pas prendre. Monsieur le mal prend examen, gon ba moi jam on ba ça l'école moi quitter l'enrepos. M'pa prendre ni. Okay? Ou pas de konwel ou pas prendre. That's it. Okay. So the answer is moderate bright red vaginal bleeding. Okay? Only one answer. Maybe vous capable de dire, okay, left hip pain that showed down the leg. So no. So let me go quickly with the rationale, guys. And I have to leave. I have to leave. Okay? Why not headache? Non seulement tête fait mal la client, c'est 2 seulement sur 10. OK? Là, disons mild, not even moderate. OK? Mild pain. On petit douleur. OK? OK? So 2 sur 10. Au moins si son douleur m'a quitté 7, you know what, 8, 9, commencez depuis nan 6, ne ka commencer worry. OK? So m'ba prendre. So pour qui ça fando high, m'ba jam capable prendre, c'est juste fando high toujours indiqué OK, so mes côtés par exemple ti moun nan capable bien dans combien semaines. OK? And feeding edema que il y a only 1 plus. And this is normal finding in case study. I mean in pregnancy. So le yon moun enceinte, li toujours gen une inflammation, guys, OK? Si pied moun nan toujours enflé, nous connaissons ça, li son bay qui normal lié. Peut-être si m'dam de gon 3 plus, 4 plus, oh, m'tap vraiment réagi. But si son bagay 1 plus, OK? That's normal finding. Pas prendre yon bagay nan examen que you expect. If you expect something, please do not pick up that expectation. So just leave it alone. And left hip pain, the reason I didn't pick up this one for my select all that apply, okay? It's a common discomfort of pregnancy characterized by hip pain that radiate shoot down the leg, okay? It occurs when the growing uterus puts pressure on the sciatic nerve, okay? So, nous gen sciatic nerve nou, tout autant que ti moun même la grossi so li vin fè yon pression kounya, okay, so uterus et maman, okay? So pression sa li vin toucher sciatic nerve nou, maman. So, sou pa li yo, sou pa kon expectation, so pral pran ça 0, a perdu green point pour te jwen nan 0 sur 5. 0 tête marée. So questions number. Pour qui ça c'est ça moi pour moi faire follow up. Any amount of blood, guys, quelle que soit n'importe quantité sang pendant que mon enceinte. Et puis on do moderate bright red vaginal. Okay.